So good evening, everybody, and welcome to the Illinois Spina Bifida Association's adult group and partner presentation with the Margaret Hackett Family Program in Central Nervous System Congenital Anomalies from the University of Chicago. We are delighted to have as partners tonight great colleagues from the University of Chicago Medicine. Joining us are Julie Dressler, the program manager at the Margaret Hackett Family Program, Dr. David Frim, the program director at the Margaret Hackett Family Program, and our guest presenter, Laura Williamson, a nurse who's going to talk about wound care and wound prevention. We are delighted to have such a great group tonight for a very important topic. I'm going to now hand off here to Julie, who has been a great partner and a number of ISBA programs, and we're just delighted to be having this group together tonight for some important work. Julie?
Yes.
All set. Thank you so much.
Hi, Matt. Thank you so much for having us here tonight, and thank you for giving us the chance to present. So the Margaret Hackett Family Program is a program that focuses on central nervous systems and congenital anomalies over at the University of Chicago. So we've been a program for almost 4 years now, focusing on various research initiatives and advocacy as well. So we would love to be a resource for any questions that you might have in the future, whether it's advocacy and resources that you may need, or if there are medical questions that you may have as well. We would also love to refer you to a medical professional. So at the end of the night, I will go ahead and I'll drop our information in the chat. So you can reach us by email, by phone, any which way. And you can also visit our website for lots of resources. And as Matt said, Dr. David Frim is also on this call. So he is a retired pediatric neurosurgeon who's now our full-time program director, who leads the research and all of the initiatives. So he is a great resource and has tons of connections for everyone. And tonight we are more than lucky to have Laura Williamson with us, who is a registered nurse here with us at University of Chicago, focusing on wound care and ostomy. So she will be our expert for the evening. And Laura, I will let you begin the presentation.
Great. Well, good evening, everyone. It is truly my pleasure to be able to speak to your group tonight about this very important topic of wound and skin breakdown prevention. As you all know, persons with spina bifida have faced some lifelong challenges, and I am very excited to provide you with some knowledge that will help you prevent skin breakdown issues. So I'd like to share my screen. I've got a little presentation for you guys. Okay, can everyone see the screen? Okay.
Yes,
perfect.
Thank you.
Okay, so, sorry. It's got a view that I've got it. There we go. All right. So at the end of this presentation, you will be able to identify risk factors for skin breakdown and identify strategies for preventing skin breakdown. A little background on this topic. Skin-related issues can have a significant impact not only on your health, but your activities of daily living and quality of life. Complications related to wounds was reported as the second most seen problem noted in clinics for patients that are being seen for spina bifida. Patients hospitalized with pressure injuries were found to have an increased length of stay compared to those who do not have pressure injuries. And according to the National Spina Bifida Patient Registry, 26% of individuals have a history of having pressure injuries. And it was noted that there was a lack of guidance for guidelines for the spina bifida population related to the prevention of pressure injuries and other skin breakdowns. And that being said, as I was getting ready to prepare for tonight's presentation, I thought the same thing. And so my approach to this tonight is to give you a presentation that's specific to some of the concerns that might be specific to the spina bifida population, but also to understand that what I do on a daily basis is I come up with strategies to help patients that have different types of issues with mobility and different risk factors for pressure injuries. So I'm using some of those same guidances to kind of educate you guys tonight. So understanding that there was a lack of direction for the spina bifida population related to prevention, there was a panel of experts who were experts not only in the care of spina bifida patients, but also wound care experts were on this panel. And what these experts did is they developed some guidelines that were based on evidence as well as clinical experiences of healthcare providers to give us a more standardized approach to the prevention of skin-related issues seen in the spina bifida population. So the goals of these guidelines were to help patients with spina bifida achieve the best skin health. The goal was to increase a person's quality of life by preventing skin breakdown. Also to reduce the financial impact of treating skin breakdown and to provide specific steps to preventing skin breakdown. And there's an old pearl of wisdom that says that it's easier to prevent something than it is to treat something. So when we think of risk factors, we have to think, well, what makes a person at risk for skin breakdown? And there's a few things that are common among patients that develop skin breakdown and pressure injuries. One of those risk factors is someone who suffers from prolonged immobility. Another one is that certain patient populations can't sense or feel pain or pressure. Being in a wheelchair for a prolonged period of time places a person at risk for skin breakdown. And having issues with incontinence, both urine and fecal, is another risk factor for the development of skin breakdown. And then patients that maybe have had recent surgeries maybe are also at risk for skin breakdown. So when I educate my patients about skin breakdown, I always tell them that there's two things that when they're paired together, it makes for, I always say, a bad marriage, and that's immobility and incontinence. And so those two factors together really increase a person's risk for skin breakdown. So as a wound care nurse, I have to be able to manage and offer recommendations for both of those issues. Now, when I think of the spina bifida population, I have to understand a few things. I have to understand that there's different types of spina bifida, and I understand that this is a defect at birth, but when I look at it, I have to understand that there's different levels of spina bifida depending on where the lesion is in the spine. And I understand that the higher the defect on the spine, that affects someone's ability to move their legs. And so when I'm looking at the two types of spina bifida that maybe could have the greatest risk for resulting impairment in movement and mobility, I'm thinking, and I look at those individuals that suffered from like the closed neural tube defects or the myelomeningocele deficits. And in both of those populations, these you could see some weakness in your legs, and there's some component of lack of or problems with control of their bowel and bladder functions and controls. And so I have to take that into account when I'm offering guidance to someone. There's also could be a problem with sensation. And the problem with sensation is that if you can't feel or sense that there's pain, that's usually a trigger for someone to say, hey, I got to move, or I got to do this. Or for instance, in the case of burns, commonly what happens is that someone might be, you're in your chair, you're getting hot fluids out of a microwave, you place them on your lap, and that's could be a common cause for a burn. Or the temperature change, you're not able to sense that the water in the tub or is too hot, and that can result in burns. So we have to think of the different strategies to help prevent and reduce those risk factors. And all of these are things that we can modify and change to decrease someone's likelihood of developing skin breakdown. Now, specific types of there's several types of skin breakdown that really anyone with spina bifida can have, and also people with like mobility issues, or even that problem with sensation. Let's say, for instance, in someone with diabetes, for instance. So we've got those seat-related pressure injuries that comes from being in a wheelchair, a motorized scooter for long periods of time. Like I said, we've got the burns. Usually that comes from hot liquids spilling onto your legs, your arms, your chest area. When you're getting either food out of the microwave, off the stove, we've got those burn-related injuries. There's also a risk for frostbite. And the reason for that is that if you have problems with sensation and you can't sense changes in temperature, you don't know that, like your fingers, your ears, the tips of your nose, you don't know that they're getting too cold, and that trigger that says that, oh, well, my hands are getting cold. You don't sense that as quickly. And so you might not get in from out of the cold. Sunburn is another thing that it's another type of burn that we see in the spina bifida population. And foot ulcers. A lot of times the foot ulcers are the result of some patients you might have a different type of brace or a splint, or sitting up in the wheelchairs. Or if you are ambulatory, you might have some issues with bumping or knocking into things, or poor fitting shoes. These are all things that can cause foot ulcers. So these are things that, as a provider or as someone who wants to prevent wound care, these are things that I have to take into consideration, and so do you. So like I said before, prevention is the key. And there's certain, within those guidelines that were recommended, there's things that we can tell our patients to do. And so these are just some of the things that you can do. So one of the things, and one of the most important things that you could do, is inspect your skin daily. And some areas that you want to focus on. You want to focus on your heels, your ankles, the bottom of your feet. You want to look at your hips. If you can, you want to look at the back of your thighs. So a common area for people that are in wheelchairs for a long time is that area. The technical or medical term is your ischium. And the way I describe that is where your butt meets your thigh. And so these are areas that are prone to skin breakdown, not only pressure injuries, but when our body moves one way and the surface we're sitting on or lying on moves another way, that causes a stress on your skin. And over time, if that continues to happen, we can have what's called like a friction-related skin injury. It's recommended that anyone that is wheelchair bound or spends the majority of their time in a chair or a wheelchair has a pressure relieving cushion. And by that, I don't mean like a pillow that can flatten or one of those donuts that you could buy over the counter. This is specifically a pressure relieving cushion that they sell and specifically make for wheelchairs. If you're using braces, you have to make sure that they're well fitting, that there's not any areas that are over your bony prominences that are applying pressure, and that they fit properly so that there's not a rubbing that can occur. Sometimes when we have these braces or these different prostheses, you may not always develop a pressure injury, but again, if your skin's going one way and it's slipping the other way in this brace or this prosthesis, it puts a strain on your skin, and that can break your skin down. And then once your skin is broken down from one of those devices, it's usually not recommended that you wear that device until that area is treated. And more importantly, for some of these braces, if you do notice that you're starting to get skin breakdown, you should go back to the person that fitted you for that brace or that prosthesis and make sure that, have them remeasure you and make sure that it's still the appropriate brace or prosthesis for that area. We talked about bath water temperatures, and it's important that if you have any problems with sensation, that you check the temperature of your bath water, and they sell bath thermometers over the counter that you can be sure that the water isn't too hot. One of the other important things that you could do is you have to keep your skin warm and dry. So if your skin is constantly exposed to moisture or wetness, that breaks the skin from the top down. And that can lead to issues, some issues where once your skin is broken, it can set you up for problems with infection. And you may have heard of things like cellulitis. Sometimes the infection can get so bad that it could go into the bone. So we've got to make sure your skin, believe it or not, is the largest organ of your body. It's your first line of defense. And once that skin is broken, it sets you up for some possible complications, and infection is one of them. When you're sitting up in your chair or your wheelchair, a lot of times people think, well, I'm doing good. I'm sitting up in my chair. I'm not laying in bed all day. And yes, that's true. But the important thing is when you're sitting up in a chair or a wheelchair is that every now and then you have to shift your weight a little. And it should be done about every 10 to 15 minutes while you're sitting up in that chair. And it could be something as simple as like lifting your right leg up a little and your left leg up a little. You got to move your feet and try to kind of wiggle your butt a little to get it to kind of help relieve pressure. Another thing that's really important, and people often overlook this, is that it's important to drink plenty of water. And when I talk about the skin, we're going to talk about water a little later on, as well as some other benefits, but it's important that we keep our skin hydrated. And as we age, our skin goes through different changes. And so the layers of our skin become thinner. It becomes less resilient to change. If we get a cut or a sore, it might not heal as fast. So we want to keep our skin and our body hydrated. And then it's also important to eat healthy foods. Eat a good selection of healthy foods. Make sure that you have a well-balanced diet that includes protein, fruits and vegetables, your greens and your grains. These all support good health. And it really becomes important if you should develop some skin breakdown. Nutrition is a key factor that if you have poor nutrition, you will have delayed wound healing, and it also puts you at risk for developing skin breakdown. So nutrition is very important. So we're going to talk a little bit. We said that spina bifida, you can have issues with mobility, but you can also have issues with your bowel and bladder control. And so it's important to understand, and I'm sure that you've been told this before, but with spina bifida, there could be a problem with the brain sending a message to the bowel and bladder. And that can result in poor bowel and bladder function. And you add that with mobility problems, that you can't get to the bathroom fast enough, then this can also place you at risk for skin breakdown. So what we really want to do is we want to try to promote continence. And there's different ways that that can be done. In terms of, and it's important that we kind of help train the bowel and train the bladder. And so I kind of think of this as like, if you want to avoid having an accident, you have to maybe toilet yourself a little more frequently, okay? And so you should always go to the bathroom when you have the urge, but to kind of help get some control, you want to try to hold that for a minute before sitting down. And that kind of trains the bladder so that it just doesn't empty right away. You need to create routines, and you create routines to avoid accidents. And another thing, to avoid incontinence overnight, it's best to limit your drinks 2 hours before bedtime. Now, as you see in this picture, there's tons and tons of products that are sold over the counter, and it can be a little overwhelming. So it's important that, so depending on your level of incontinence, sometimes you could get away with maybe just having like the poise pad, where you put a pad in your adult underwear or briefs. But sometimes you might have to wear something more like a Depends or an adult brief. And it's important that when you use those, that you have to change those frequently, because what those adult briefs do is they actually direct, the urine is sitting directly on the skin. And so urine and stool can, believe it or not, break the skin down quite easily and in a short period of time. So when you are wearing those types of briefs, or if you have to wear those, it's important that you change them frequently. And another thing that you could do to protect your skin is you could use a moisture barrier ointment. And what do I mean by that? Well, what I mean by that is they sell products over the counter. I personally prefer the products that come with some sort of zinc oxide component to them. And what it does is you apply it to your buttocks, and it provides a shield or a barrier. So what happens if urine and stool come in contact with that, it provides a wall or a barrier. So it breaks down that barrier before it breaks down your skin. Here again, we talk about the importance of drinking fluids. So one of the things that can also be seen is constipation. And one of the best ways to prevent constipation is, again, drinking 6 to 8 glasses of fluid a day. In terms of the fluid, it's important to understand what might irritate your bladder. So those are things like you should limit caffeinated beverages. You should limit those fizzy drinks that they sell. And also understand that the drinking of alcohol can irritate your bladder. It's important when we talk about maintaining a good bowel health that we focus on adding fiber to your diet, drinking fluids, and exercising to the best of your ability is good ways to promote good bowel health. Also not pictured here is for men, there is a condom catheter that could be connected to a leg bag, and that could be worn under your garments. So that could be another way to prevent urinary incontinence. There's pads that you could put over, like when you're up in your wheelchair, you could put that over your wheelchair cushion. These pads or incontinence pads are designed specifically to wick the urine into the pad, and it keeps your skin dry at the same time. So those could be put over your wheelchair cushions as well as over your sleeping surfaces that you're sleeping on. There's also mattress protectors that protect your mattress from moisture. So those are all things that you can buy from over the counter to help protect your mattresses, your chair cushions, etc. And then if you had any questions about maintaining bowel regularity, it's best to consult your healthcare provider before, starting a whole bunch of trying to navigate the whole oral medication scene. And your doctor can kind of best describe to you whether you should be using a laxative, what type of fiber, because all fibers aren't created equal, and just ways to kind of help keep your bowels regular. So what I want you guys to take home from this presentation is that measures can be taken to prevent skin breakdown and pressure injuries. I want you to also understand, and it's often a common misconception, that when people get skin breakdown on their buttocks, they automatically assume that it's a pressure injury. But there's other types of wounds that you can get that aren't related to pressure. And so some of them could be the moisture-associated skin damage and the friction-related skin injuries that could happen because you're trying to move one way while the surface is going another. And so that repeated friction breaks your skin down. And it's important to understand that a pressure injury is something that I call a bottom-up injury. So it happens deeper underneath the skin. And by the time you see it to the surface of your skin, that had started beforehand. So the damage was underneath. Where when we're talking about friction and moisture-related skin injuries, that's what I call a top-down injury. So the urine in the stool, or those constant forces from slouching in the chair or scooting to get out of bed, those are top-down injuries. So those are different types of injuries. It's so, so important that you do a daily skin assessment. That's key. And if you notice any type of skin breakdown, you contact your provider immediately. And you have to make sure that while you're in your chair, that you're using a pressure reducing cushion while you're in the chair or wheelchair. And it's important to make sure that the shoes that you're wearing and the braces that you might need are well fitting. Shoes are a big culprit to your foot ulcers that you can get. If a shoe is too small or too big, it can cause skin breakdown. If you have problems, not only, let's say that you have spina bifida and you have diabetes and you get an ulcer to your foot, the diabetes could make it slower to heal and more difficult to treat. So it's really important that when you're doing your skin inspection, that you look at your feet, you look at the heels, the soles of your feet, the sides of your feet, and make sure that if at the start of any skin breakdown, you're contacting your healthcare provider. Sorry, I talk a little fast. So I guess, are there any questions?
So, Laura, great presentation so far. Thank you.
Mm-hmm.
We had one comment, and a participant said, I use an enema in order to have a bowel movement.
Yes.
A while back, I started using stool softeners in order for me to have one.
Okay.
So just a comment on that.
So stool softeners are definitely good. The role of a stool softener is that they add water to the colon So you can use a stool softener to help with that, but even more effective is drinking water and fluids. That will help add water to the colon and kind of help the stool move down. Because what slows that down sometimes, depending on your mobility level, if you can't walk or you can't get around, it kind of takes it longer for that stool to work its way through the small intestines and down into the colon. So if you add water, that will be even, it will help with the stool not get so solid and be a little easier to manage.
Great, thank you.
Mm-hmm.
So if anyone else has a comment for the chat, they can send it to me and you can type it in there, or you can send it to me directly so that only I see it. I'm under the Illinois Spina Bifida Association name on the chat. This is Matt. Any other questions that for the group? Okay, so just a quick note. So I'll let people get kind of last call here for questions, and then we'll stop the recording and then people can share their questions. Julie, how about, would you like me to hand over to you and you do a little wrap up comment about the how to get in touch with the Margaret Hackett Family Program? I think I gotta let Julie unmute herself here. One moment, please.
Perfect. There we go. All right. So thank you very much, Matt, for having us tonight. So I just dropped in the chat a few different ways to reach us. So you can reach us by website, which I just dropped in the chat. So we've got a variety of resources from support groups that you can get involved with to other organizations who also offer information about spina bifida. And then you'll also see a bunch of providers as well. So if you're interested in, seeing somebody like Laura at University of Chicago, getting in contact with someone like Dr. Frem, medical advice, we would be more than happy to help. We also do consultations. So maybe you just need a little bit of advice. You need somebody to talk to, but maybe point you in a good direction, but you don't need an actual medical advice or medical diagnosis. We're also happy to do that as well. So you can find us on the website. You can also give us a phone call at 773-795-0622, or you can send us an email directly to the program at nhfcp@bsd.uchicago.edu. Like we said, we'd be happy to answer any of the questions that you have.
Thank you so much. Can everybody see the University of Chicago website here on the screen share? Thumbs up. All right, great. I'm just going to check the chat here, see if there's any other questions before we, oh, here's one here. So someone commented that this participant has a Roho cushion for the wheelchair. And that's a typical one there. You know what? And I'm gonna, I'm having a battery issue with my computer here. So any comments then, Laura, on the Roho? Yeah, I gotta ask that. 1 second here.
Okay.
Laura, why don't you try that again, please? Thank you.
I got it now. Roho is a great cushion. It's top of the line. The only thing with your cushions is over time, they may not work as effectively. So it's always a good idea to have them checked on, like at least annually, to make sure that they're still operating in the way that they are intending to operate. Once you get one, it might not last for a lifetime. It certainly will last for a long time, but you still, from the person that provided you with that cushion, you should still have it looked at.
Great, thank you. Here's another question. Any ideas for pressure relief for shower chairs when traveling in hotels?
Okay, I actually have one. I wish I had an example to show you, but there's what's called like these waffle cushions. They're very portable and they're waterproof. And we use them in the hospital for our patients that are sitting up in the chair. And so what you could do is you could take that, it folds very nicely, so it would be great for packing. And then you just take that with you. And then when you go into the shower, instead of sitting directly on the shower chair, you would put that chair, that waffle cushion down, and then that could get wet. It's not made of foam or anything. It's actually filled with pockets of air that kind of redistribute. And you could put that down on over your shower chair when you're taking a shower.
Great, thank you. Any other questions before we turn off the recording and we can bring your questions directly? All right. Well, for the sake of the recording, thank you on behalf of the Illinois Spina Bifida Association and our Illinois Spina Bifida Association adult group. Oh, we have a couple of questions, but thank you everyone for attending. A couple more questions. Thank you. What is a good diaper that wicks urine away from the skin?
Okay, so there's great products out there. Depends, does. I prefer, like, if you can, to use the pull-up. But most of the products out on the market, like your Depends brand, even like your Target brands, they all have a wicking property. The thing about it is that, like with anything, it can only wick so much urine before it kind of reaches its max ability to do so. So the key is to use that with, and change, you have to change it depending on how often how much urine you produce. You're going to have to change that. Usually I recommend that you check it every 1 to 2 hours and make sure that you are changing it appropriately.
Thank you. A participant asked if you could say, what was the cushion or the device that you recommend for use in the shower?
It's a waffle cushion.
Waffle, like WAFFLE.
Correct.
Okay, and that's a generic term, not a brand name?
It's not. I mean, I could throw out a brand name. Am I allowed to?
Yes, you may.
Okay, so what we use here at the hospital is the Stryker brand.
Stryker brand. Okay.
Mm-hmm.
Great. Thank you. Do you have a recommendation for a certain type of ointment for skin protection ointment? I think you would call it saying something with, well, I'm not going to recall. I'm going to let you say it.
I do. So I've been doing this for a while, and my favorite brand, and they have a whole line of products, is by Medline. And Medline, it's the Remedy line. And it's important to understand that there's a couple different types of products. So one of the ones that I like, if you just have urinary incontinence, let's say, then you could do well with like the Medline NutriShield, and that's more of a silicone-based moisture barrier ointment, and it goes on clear. But if you have urinary and fecal incontinence, you're going to need the zinc. So in that case, I would recommend the Medline Remedy. It's called Calazyme, which is CALAZIME. And what that is it's more of a longer acting barrier. And so you apply that 2 or 3 times a day. But what's important to know when you're using like a longer acting barrier is that it's not intended to be completely removed from your skin. Like a lot of people make the mistake, well, I'm just going to keep rubbing this off until I don't see it anymore. And that's not how it's designed. It's meant to stay on your skin. So you might see a little film or residue from that, and that's okay. You want to see that. That means that the ointment is still in place. And the reason that you have to apply ointments more than once or twice a day is because the ointments really aren't attaching directly to your skin. They're going over your skin, and they can kind of be rubbed off or get lost in your like incontinence products, your diapers or your pads, whatever you may be wearing. And so that's why you have to apply those ointments several times a day. I do like the Medline Remedy. You can get it on Amazon for those of you that like it. But other good ones that you could even just go to the store and buy are like your Desitin. Things that you would use to treat a baby's bottom are the same things that you could use for your skin. One thing I'll say about ointments is I don't like ointments in folds. So if you have a lot of skin folds, you're better off with a powder rather than an ointment.
Laura, excuse me, can you repeat the name of the, was it Calazyme that you were recommending?
Calazyme, Calazime.
Calazyme.
Yes.
Okay, great.
And then that Medline Remedy, Remedy line, it has the moisture barrier ointments, both the silicone based and the one with zinc. It has an antifungal cream because sometimes, like if you notice that your butt or like your inner thighs are really like angry red and they have like all these like little spots, it could be that maybe, and they're super itchy, it could mean that maybe you have like a fungal overgrowth. And so sometimes you have to use like an antifungal for a little bit. That Medline has an antifungal that you could use. They also have just a general like lotion, and that could be used on like your elbows, your legs, your arms, your feet and heels. Remember, when you're using lotions on your feet, you never put lotions between your toes. So you could put it anywhere else on your feet, but never put it between your toes.
Great, thank you.
Mm-hmm.
Other questions for the chat before we go turn off? All right, one more here. And could you please remind us, what is the name of the antifungal cream?
So a lot of, you could buy those over the counter. And so like your Lotramins, Gold Bond makes an antifungal powder. That Medline product line, they make an antifungal cream and a powder. It's anything that has like meconazole in it or chlorotrimazole, those kind of things. It's like the same thing that you would use to treat like athlete's foot, essentially.
Great, thank you. All right, other questions? The chat before we turn off the recordings. Great. Well, thank you everyone for this great presentation. And as a reminder, if anyone has a question about where to get medical care, feel free to contact the Margaret Hackett Family Program at University of Chicago. Or if you have a question about other services for people with spina bifida, feel free to contact the Illinois Spina Bifida Association. That's great. I'm going to turn off the chat now. And then we can turn off the recording, and then we can continue to talk for some other questions that folks had. All right. Thank you again, Laura Williamson, presenter from University of Chicago Medicine. Thank you.